According to UBC statistics, over a quarter of UBC undergraduate students report having one or more disabilities. Of these students with self-reported disabilities, only one-third of them access accessibility services at UBC. The current research has two overarching aims. The first aim is to examine existing literature on students with disabilities experiences and faculty attitudes in post-secondary education. And the second aim is to conduct thematic analysis for emerging themes in literature exploring this topic.
To conduct literature review, 15 empirical study articles were selected from 2 rounds of keyword searches on Google Scholar. 8 additional studies were included from references of selected literatures and/or excluded relevant review articles. 2 rounds of inductive thematic analyses were conducted following the guidelines suggested by Brown and Clark. Moving on to the findings, 4 primary themes emerged from 2 rounds of thematic analyses. For the current poster, however, we focus on 2 primary themes: barriers in learning and barriers in accessing accommodation. So our review revealed that students with disabilities encounter multitudes of barriers in learning. Under the theme of additional labor, for instance, it was found that students with disabilities often had to invest extra effort to achieve the same goals as their peers without disabilities. Environmental barriers, such as loud noise and lack of accessible features in universities' physical spaces, were reported to prevent students from gaining learning opportunities, including attending lectures and building student relationships. The intersectional barriers theme highlighted how oppressive narratives tied to gender, race, and socioeconomic status contribute to stigma experienced by disabled individuals, leading them to question their belongingness in university spaces. The learning method or evaluation approach theme revealed that the lack of diverse learning opportunities and evaluation methods often hinder true reflection of academic abilities and acquired knowledge of students with disabilities. So with these in mind, one can easily presume the importance of accessing accommodation in post-secondary education, given the diverse barriers that students with disabilities experience. Worryingly, many literatures in our review have reported that students with disabilities encounter myriads of barriers in accessing accommodation alone. So the first sub-theme discussed here was stigma. Students reported experiencing negative attitudes related to their disabilities from fellow students, which discouraged them from seeking accommodations. Students from lower socioeconomic backgrounds expressed greater fear of encountering stigma in relation to requesting for accommodation, once again echoing the intersectional barriers introduced earlier. The lack of understanding among faculty was another barrier mentioned. Professors' resistance to providing accommodations was attributed to the limited understanding of how disabilities manifest and affect students' academic experiences. Diagnosis as a mandatory requirement and accessing accommodation emerged as another challenge. The requirement to provide a diagnosis made accommodation inaccessible for students with invisible disabilities, intersecting identities, and/or those lacking financial means to access diagnosis. The lack of systematic coordination and communication between disability services and professors brought attention to the significant burden placed on students to advocate for their accommodations. Lastly, the theme of invisible disabilities revealed that students with learning disabilities or mental health disabilities were less likely to access disability services compared to students with visible impairments. It's also been reported that both fellow students and faculty exhibited attitudinal barriers towards students with invisible disabilities, further preventing them from accessing accommodations.
Our review suggests that greater effort on post-secondary institutions' ends is warranted to ensure equitable access for education for students with disabilities. Specifically, we suggest that post-secondary institutions diversify learning and evaluation methods, improve coordination between accessibility services and instructors. For example, at the University of British Columbia, even though the Center of Accessibility identifies students' needs and notifies instructors, students are still expected to give the professor a letter of accommodation made by the center at the beginning of the term. Keeping these factors in mind, we believe that the university needs to improve interdepartmental communication and coordination so that the responsibility for one's accessibility advocacy does not primarily fall on the students themselves. Post-secondary institutions must also evaluate physical spaces to ensure accessibility to all students. Another critical factor is diagnosis requirements. On a broader scale, it is critical to invest in faculty training on disability, inclusive learning, and technology usages. Despite this, it is important to recognize certain limitations in this area of research. There is a lack of literature investigating ableism and other forms of marginalization, oppression, and discrimination in higher education settings. Additionally, limited literature exists among first-generation, Indigenous communities, immigrants, ELLs, low-income groups, religious cohorts, and our mature students.